This is a documentary on the impact of drug abuse and government efforts in Bayelsa State. Drug abuse has become one of the most devastating challenges facing communities across the nation. The lives of millions have been disrupted, families torn apart, dreams shattered, and future lost to addiction. According to recent statistics, worldwide, 30% of youths abuse drugs, and in 2025, the NDLA reported that 14 million Nigerians abuse one form of drug or the other. Speaking with the chairman, Bayelsa State Drug Abuse, Addiction, Prevention and Rehabilitation Committee, Dr. Peter Owonaro, he highlighted the state of drug abuse in Bayelsa State.
From earlier study, the prevalence of drug abuse in Bayelsa State is 21%, and the most affected community with high prevalence of drug abuse is the Kirimom local government and Sagbama local government. And this drug abuse is more common with the youths. In view of that, we as BADAPARC, we have initiated several initiatives through the support of His Excellency Senator Doyedumi.
The various activities of BADAPARC, in line with the assured agenda of the prosperity government, include series of radio programs to sensitize people on the dangers of drug abuse. Examples of topics addressed on these radio programs include understanding addiction, myths and reality, role of family in recovery, impact of substance abuse on mental health, the importance of early intervention, stigma and addiction, breaking barriers, coping with triggers, strategies for staying sober, mindset and motivation, setting goals in recovery. In addition, the committee produces weekly bulletin with over 50 bulletins published, which serves as resource materials on various issues regarding drug abuse. As part of efforts to curb the drug menace, BADAPARC has carried out massive sensitization campaigns across public and private secondary schools in the 8 local governments of Bayelsa State, covering over 100 schools in Bayelsa State. The mission was simple: to sensitize the young ones against drug abuse and the peer pressure associated with it, while creating drug-free clubs that engages in social activities free of illicit drugs. The Bayelsa State Drug Abuse, Addiction, Prevention and Rehabilitation Committee also made advocacy visits across sister agencies, regulatory authorities, NGOs, community and religious leaders to collaborate and work together against drug abuse in Bayelsa State. Training of sportsmen were not left out to prevent doping in our sportsmen and women. The BADAPARC chairman, Dr. Peter Owonaro, highlighted the efforts of the collaboration.
From the ends of BADAPARC, we have also collaborated with NDLA, UNODC, where we started with the Unplug Program 1, and currently we are into Unplug 2. Our approach is first with the prevention strategy. Second is the rehabilitation strategy, where those that are affected are not ready to listen to you. Rather, it is important that we rehabilitate them back to the society and give them the necessary information to equip them against drug abuse.
2 of the rehabilitated survivors share their story at the rehabilitation center after getting their informed consent.
My name's Alur David Tamarakro. I was into various kinds of drugs, like starting from alcohol. I was much more way younger. Then I think I started doing cigarettes when I was like 16, 17. But I started doing these legal drugs, like illicit drugs, when I got into the university. And believe me, it ruined my academics and education to the point that right now I should have been a graduate, but unfortunately I'm not. I got a lot of support from my family, my mom, my sibling. So they came around, they were come seeing the rehab, bringing me foodstuffs, paying my bills and everything, making sure that I was okay during this process, because you understand that is not easy for me, and also it's not a rushing kind of process. After my rehabilitation center, there's no more going back to that kind of life. I am drug free for over a year plus now. It's something I could not have been able to do quite some years back. Next step I'm looking forward to is me going back to school. My advice to them is just to young people, I think for real, they just practically need to focus on the fact that they should get their life together. That drugs is just an escape to them that they have accepted. Brain is a lie. Once you have done with your drugs and your ecstasy stage, everything that is past, you still come to that realization that your problem has not been solved. So channel those energies you use in trying to go and buy drugs, those money you use in going to buy drugs, just focus on your life and you see that you get a better life out of everything. And for older people, my advice for them is the fact that they have been able to do drugs to the certain stage of still like having family and still having people around them. They should understand that the dangers of them doing those drugs around those growing ones, those younger ones who haven't started. They are giving them this feel free mentality to accept those things as norms, which is very bad. So now, I just want an opportunity in life for me to go back to school so that I can be able to get a job.
My name is Martha. This whole thing started after the death of my husband. He was a military man. He died in Boko Haram. And the pain and the grief was much. I took to drinking. So I tried using tramadol for a short while. At that point, I discussed with a doctor and he said, okay. So he placed me on pentazocine, 30 milligram daily for 3 days. Yeah, I felt better. The pains were relieved and all that. After a month, I need to take pentazocine without informing him. I took the injection. I could do everything. I can work for 72 hours straight duty. In fact, I could take up to 3 ampoules, which is 90 milligram at once. And I could take it for 3 times a day. I refuse to tell myself, I refuse to admit to the fact that I have become an addict to pentazocine. And my brother tried helping me. I attempted suicide twice. So I lost my job and I got another. And after 3 weeks, I was told I cannot continue because people were asking questions. What happened to your hands? Actually, as a result of taking the injection, I happen to have some scars. This family doctor friend also that somehow tricked me into, okay, this is not the life you're supposed to be living. And I was like, look, I'm really tired and exhausted. I am really. There are 1,001 persons out there that are going through what you are going through. And there are people that have succeeded in coming out of it. It's not going to be easy. But it is up to you to be open-minded. If you're open-minded and go to God, ask Him for forgiveness. He's always willing and ready to do that, to answer us. There are people out there who do not even have anybody to encourage them, to drag them out of this thing, to give them help or rehabilitation. But if you find the opportunity, please take that opportunity and take a new leaf and walk out of substance abuse. I'm an excellent baker, so that's what I'm going to do right now. Go back to my baking and do exploit with my hands. Though I've been having some challenges here and there, but I believe with time, God is going to provide funds for me.
One of the therapists at the rehabilitation center addressed the myths, facts, and truths about the reality of dealing with individuals who are abusing drugs. She had this to say.
Recovery is possible. This is due to the fact that addiction is a chronic relapsing disease of the brain and only needs support. Know that it's a disease like any other disease. Family is the greatest support.
Substance abuse not only takes a heavy toll on individuals who fall prey, but affect families and the social fabric of the communities. But the journey to recovery is possible. On a final note, the BADAPARC chairman shares his thoughts on the ongoing work at BADAPARC.
In view of that, for the past few months, with the current research we just conducted, the prevalence of drug abuse in Bayelsa has dropped with 5%. So this is a big turnaround against the WHO recommendation that if nothing is done, the prevalence of drug abuse from that 21% will increase by 20%. And I must, at that junction, give all accolades to His Excellency, the Governor of Bayelsa State, Senator Doyudiri, for his support for BADAPARC in fund and also in physical, moral support that he has given us. We're on Plot 2. We intend to train local government coaches, school coaches, and we have further established a drug-free club in over 100 schools in Bayelsa State. Following the theme of the year, the theme simply named Break the Chain. Prevention, treatment, and rehabilitation for all. By virtue of that, my promise to Bayelsans and the youths of Bayelsa that BADAPARC, through the support of His Excellency Senator Doyudiri, will focus on prevention and we will treat and rehabilitate those that are affected to integrate them back to the society. It's not Bayelsa in the future without you, the youth. By virtue of that, we say, please encourage good moral, good standard of living, and also avoid drug abuse and addiction. Thank you and God bless.
If you or someone you know is struggling with drug addiction, seek help today. Call the BADAPARC helpline displayed on the screen. This message is brought to you by the Bayelsa State Drug Abuse, Addiction, Prevention and Rehabilitation Committee with the support of the Bayelsa State Government.